we will discuss some potential health complications associated with MGUS and how we monitor for those issues.
While MGUS itself doesn't usually cause symptoms, it is linked to certain conditions that can affect the bones, kidneys, nerves, immune system, and other areas of the body. One complication to be aware of is a group of conditions called monoclonal gammopathy of clinical significance, MGCS. This term is used for cases where MGUS results in organ damage, particularly in organs like the kidneys, nerves, or skin. For example, in monoclonal gammopathy of renal significance, MGRS, abnormal proteins from MGUS can damage the kidneys. Identifying MGCS or MGRS can be challenging because symptoms vary and can overlap with other health issues.
Bone health is another area of concern for people with MGUS, as they are at an increased risk for fractures, particularly in bones of the spine, pelvis, and ribs.
This risk may be due to an imbalance in bone metabolism or changes in bone structure, though the exact cause isn't fully understood. We recommend routine osteoporosis screenings as our standard for age and risk factors, and we may evaluate for fractures with low thresholds, meaning that even minor concerns could prompt imaging. People with MGUS also seem to have a higher likelihood of infections, potentially due to underlying immune system changes. Research has shown increased rates of both bacterial infections like pneumonia and septicemia and viral infections like influenza and herpes zoster.
Another area of increased risk is blood clotting issues, such as venous thromboembolic disease.
Although it's uncommon for MGUS itself to directly cause blood clots, some patients may develop a condition called monoclonal gammopathy of thrombotic significance, in which certain antibodies may lead to abnormal clotting. Lastly, there is a slightly higher risk of developing certain cancers, including some blood cancers like myelodysplastic syndrome, MDS, or more rarely, acute myeloid leukemia, AML. Overall, the approach to monitoring MGUS involves routine checkups and screenings similar to those recommended for the general population, with extra attention given to bone health, infection risk, and clotting issues.
This monitoring helps us catch any signs of progression or complications early and manage them effectively.